He's the NDP critic for long-term care, retirement homes, and home care. Wayne Gates has also had a lot of concerns for healthcare in general in the province. He's holding an emergency town hall meeting February 9th at the Gale Centre in Niagara Falls. Wayne, some of your concerns, what are you going to address at this meeting?
Well, we're very fortunate that we've reached out to a lot of the partners in our community. So we're going to have Natalie from the Health Coalition. She's coming to be one of the panelists. We have doctors going to be on the panelists, paramedics. We have ONA that's going to come and be part of the panel. And we're hoping to have somebody from mental health. As you know, mental health is a really big issue in this area. Mental health and addictions, where 1 in 5 are suffering here in Niagara, so we're hoping to have that. But we really want to, I don't think anybody's really reached out to the community to talk about the needs around healthcare and what are some of the challenges and what are some of the challenges in our hospital system and why are we in crisis? We have a publicly funded healthcare system that's the envy of the world. Being Canadian, and if you talk about Canada, all they talk about is, you have a publicly funded healthcare system.
And that's one of your concerns, is this opening up of privatization by the Ford government.
That's a very big concern. And so how did we get to even be discussing the privatization of our healthcare? Well, that started by the Ford government bringing in bills that really attacked our healthcare system, like Bill 124, which attacked nurses, healthcare workers, paramedics, correction officers, anybody in public service, and drove down their wages. So nurses who are working off their feet for the last 3 years with COVID, and by the way, COVID's not over yet, and hopefully you'll give me a chance to talk a little bit about long-term care, is that they're feeling disrespected. We have to say thank you. This healthcare crisis forum is not about attacking nurses and workers. This is about saying, what can we do to fix it? So
what's wrong with the system,
what's wrong
not with the people within the system?
They work so hard, and I know that because I get the calls. I know that some of the nurses, before they go into work, are sitting in their cars half hour early, and they're breaking down crying because they know what they're going into.
And some are leaving the profession.
In record numbers, they're leaving because of the disrespect, because they don't feel they're appreciated. And the reality is that under Bill 124, it capped their salaries. And it's not always about salaries, but as we've seen with food prices, with rents, with trying to own a home in this province, everything's gone up. And so they were capped at 1%, yet inflation was running at 6.5% and 7%, a little over 7%. And that becomes a 6% pay cut at the same time that they were going to agency companies that were providing nurses who were coming into our healthcare system making $25 and $30 an hour more than they were, getting the preferred shift, not working the weekends. So that was it's really hard on the nurses. So what I'm saying to the government, how do we fix that? It's already been ruled that Bill 124 should never have happened. It was illegal. They've appealed that decision. Makes absolutely no sense. So that was one of the things that started it. Bill 7, where they attacked the long-term care, where in alternate level of care, they're throwing our seniors out that could go 150 kilometers away from home. Makes absolutely no sense to me. We're still having our long-term care facilities, particularly our private homes. And if you want to compare what would happen under a private system in our healthcare system, you have to just look at long-term care and the number of people that died in long-term care that were privately owned, where that was where the real problems were. We had to send in the military, as you recall,
yes,
where people were dying from a basic need of water. And so we're saying, with having the forum and here's an opportunity for you to be heard. And I don't believe residents are being heard. You hear it from the politicians, you hear it from people like me all the time.
What percentage of your calls into your constituency offices are coming from residents concerned about healthcare? Is it higher than 50%?
I can't give that. In fairness, all I can tell you, we're getting lots of calls that we ended up talking to Niagara Health about. A lot of problems, particularly in our emergency rooms, where, as you know, people are waiting 8, 10, 12, sometimes a day to be seen, depending on when it is. Our paramedics are lined up at the door where they're spending most of their shifts on offload situations because we don't have enough nurses to relieve them so they can go back out and do what they want to do. They want to be out in the field. They want to be taking care of the residents that need their services, but they can't get out on the field. So paramedics are obviously a big issue, the offload issue. But the big issue is staffing. How do we correct the staffing? The first thing that I think we can do, because you got to have solutions, right? You can't just complain and complain and complain. But we have solutions. We're saying, let's get rid of Bill 124. Let's start retraining and recruiting our nurses. Let's make sure that the ones that are leaving, let's have those conversations with them. What do we need to be better so you'll stay? Rather than say, you know what, I've had it, I'm walking away from this. Even though they love the job, you know, they love their patients. They want to make us better. You know, I go in the hospital, I feel quite confident knowing that that nurse wants to make me better. But I also know that they can't do the job that they're hired to do because they're run off their feet.
Are you confident that when this new South Niagara Hospital is finally open, that it will solve some of the issues that we have with emergency room waiting times and things like that? And I know that's a long way off in the future.
I'm actually meeting with the president of Niagara Health this afternoon at 4 o'clock and some of her team to talk about the Niagara South Hospital. I'm trying to find out why it's been delayed a year. So that's really concerning to me. I've sent a letter off to the Minister of Health. Unfortunately, we sent it off just before Christmas. We've called them almost every day last week. They don't seem to reply to our request to say, why did you delay it? You know, we need more services. There's no doubt about it. We need a new hospital. Is that South Niagara Hospital going to service the entire South area? We've got some concerns around what's going to happen in Fort Erie. You know, I'm not going to speak for
Welland as well.
I'm not going to speak for Welland or some of those. Obviously, you have MPPs there and you have a mayor over there, but some of the concerns there. And what is the role of Niagara Health? Is it to make sure that we have access to publicly funded health care where you need it and when you need it, which includes small rural towns?
Wayne, you're starting the session, I guess, with the panel, and will there be a chance for a Q&A session?
I may open up just talking about long-term care because I am the critic of long-term care. And we have challenges in long-term care. If you take a look at the last 2 reporting weeks, people don't realize 56 seniors died in long-term care facilities in the last 2 reporting weeks. 56 of COVID. It's not over, and seniors still have got lots of issues. Bill 7, I told you, you send people all over the province of Ontario rather than staying close to home. So I'm going to do that, and then we're going to open up with the panel. We have an
question and answer?
We have an expert panel that hopefully will give some talk about the crisis, talk about what we have to do to help fix the crisis, how we want to say to the government or to Niagara Health that we want to work with you for solutions. I believe there are solutions without privatizing our health care.
February 9th, what time does it start?
It starts at 6:30, goes to 8. To answer your question, yes, we're hoping to have some question and answers. And I believe that there will be some people that will come and tell their stories on what transpired when they went to our hospitals and kind of have it open. I think it is so important to communicate with the public. I think that's the biggest issue. I don't think we've been talking to the public enough. Let's hear from the public. Let's hear how they feel about their healthcare system. And do they believe that we should fight as hard as we can to protect a publicly funded, publicly delivered system. We do not need to further the privatization of healthcare in not only in the province of Ontario, but right across the country.
Wayne, thanks for joining us today, and I know it will be very well attended. Thanks again.
I appreciate having me on. As always, thanks again. I appreciate it.